Hi, my name's Campbell Murdoch. I'm a GP working in the southwest of England, and I'm also a Public Health England physical activity clinical champion. The clinical champion role for me entails going out to venues, maybe GP practices or hospitals, to meet with all healthcare professionals in a protected learning time. During that learning time, we'll spend anywhere between an hour and 3 hours, depending on how much time people have, to go through a presentation and a sort of shared learning experience, really, to cover the basics of science behind why physical activity is so beneficial. We'll also look into the levels of physical inactivity and then the risks that come with that. Leading through that, we'll go down to a bit of the cellular level of the benefits of physical activity, which many people find really interesting. With this learning, though, actually what people find really important is how do you turn this into action. So we then will often touch on brief interventions and motivational interviewing. About 2/3 of the adult population are not active enough for good health. About 20% of the adult population are inactive. That's less than 30 minutes of moderate physical activity a week. This is leading to early death, unfortunately. Physical inactivity may be responsible for up to 1 in 6 early deaths. It is also leading to a huge cost to the England as an economy. Not only the cost to healthcare service and social care service, but people being off work ill and actually just not being at their best every day. It's estimated to cost the economy something like £7.6 billion per year. The long-term conditions we are now seeing in our healthcare system are long-term conditions that probably aren't around if we lead a life that the human body was designed for. So things such as heart disease and type 2 diabetes, these come about through poor metabolic health, including physical inactivity. So if we're going to tackle the root causes of these problems, we've got to be talking about physical activity. We've got to be supporting people on a one-to-one level to become more physically active, as well as becoming part of a community movement.